Good evening, everyone. I'm Lynn Fridley, Program Coordinator for Maddie's Institute. The topic tonight is canine behavior modification in animal shelters. At Maddie's Institute, we are committed to helping you find innovative, humane, and effective ways to keep animals happy and healthy while preparing them for placement in a new home. Dr. Sheila Darpino is a veterinary behaviorist with the Center for Shelter Dogs at the Animal Rescue League of Boston. She graduated from veterinary school in 1996 and in 2005 completed the first ever Maddie's Shelter Behavior Residency. Since 2008, she has developed and implemented dog behavior programs at the Center for Shelter Dogs and has generously shared these programs with shelters across the nation. Now, before we get started, there are a few housekeeping items that we need to cover. First, 10 audience members will be chosen in a random drawing for a door prize. Each will receive a set of 3 Maddie's Adopt Me vests. We will contact the winners via email, so good luck. Next, please take a look at the left-hand side of your screen where you will see a Q&A window. That's where you will ask questions during the event. Dr. Darpino will answer as many as she can at the end of the presentation, but please submit your questions early. Questions submitted in the last few minutes will not be processed in time for a response. If you need help with your connection during the presentation, you can click on the question mark at the bottom. That's the help icon. There are other little images along with the help button. These are called widgets. The 2 green file widgets will take you to the resources that our presenter wanted to share with you, as well as some from Maddie's Institute. The resources will also be available on our website after this presentation, so don't worry if you don't get a chance to review them during the event. Before I turn things over to Dr. Darpino, I want to say a few words about Maddie's Fund. We are the nation's leading funder of shelter medicine education, and it is our goal to help save the lives of all our nation's healthy and treatable shelter dogs and cats. The inspiration for that goal was a little dog named Maddie, who shared her unconditional love with Dave and Cheryl Duffield. They promised her that they would honor that love by founding Maddie's Fund and helping make this country a safe and loving place for all of her kind. Please use what you learn here tonight to make the dream be inspired a reality. Dr. Darpino, thank you for being here.
Thank you very much, Lynn. I'm so excited to be here with all of you tonight, talking about the Shelter Dog Mod Squad and identifying and modifying canine problem behaviors in shelters. We are going to start things off with a poll.
And the poll question is coming up. Hopefully this poll question is coming up. Yeah, there it is. Okay, everybody in the audience, we need you to answer this poll. If a dog in your shelter has any of the following problems, would your shelter likely rehome the dog? If your answer is yes, select all that apply. And you'll have to scroll down to see all of your choices. So look through our menu here, and please submit your answers. We'll be sharing those answers with you in just a minute. So let's see what we're saying. Okay, good results. Dr. Darpino?
Great. Yeah, we got good results, and it looks like a lot of you are adopting out pets with problem behaviors. That's really exciting to see and exciting to hear as the sheltering world changes and we start to find homes for pets that we previously thought were more and more challenging and see them do very well in homes. It's very, very rewarding. So I hope to share some information and news with those of you who aren't adopting out these types of pets. And for those of you who are, I hope you learned something from us today too. All right, so our mission today as the Behavior Mod Squad is to identify potential problems in our shelter dogs, make outcome decisions about them, optimize their welfare, do behavior modification if needed, reassessment, so reassessing them to see how they're responding to that behavior modification, rehome them obviously, that's our goal, get them out of the shelters, and follow up to make sure, because rehoming is one thing, making sure that they're happy in the home is another. So that's our mission, but when we really look at our mission, I kind of want to reorder the way that mission is listed, and that initially we had listed first identifying potential problems. And our first mission and our first goal as the Behavior Mod Squad is really to optimize welfare. That's what we do and provide first. And once we do that and we're doing a good job at doing that, then we work at getting to know the dogs better in terms of identifying any potential problems. And in our shelter, we actually start to do some behavior modification and see how they respond to behavior modification in most cases, most dogs, before we make an outcome decision, because that helps us in making our outcome decision. I'm going to introduce you to 2 dogs now. The first is Nellie. Cute little Nellie is a 1.5-year-old spayed female rat terrier, about 11 pounds, so tiny little thing. She was surrendered by her owner. Her owner was a vet student, and like many vet students, she was very, very busy and busy with school, and unfortunately, in addition to that, she was having some personal problems and could no longer take care of Nellie. She loved this dog to death. This was her first spay surgery she ever did, and she was very devastated to give her up, but she recognized that she couldn't care for her properly. So that's our first dog. Our second dog we're going to be talking about today as we work through these cases is Brody. Brody, at the time of this story, was a 1-year-old neutered male mixed breed dog, about 65 pounds. Some people would have called him a German Shepherd mix. When we have a mixed breed dog of unknown parentage, we prefer to call them a mixed breed dog because we really don't know what he is. This dog was a shelter return. He had previously been adopted from us as a jumpy, mouthy dog, so a very excitable dog. He also had some mild food aggression, and he was returned to us for biting the owner 4 times. So a lot of shelters see a dog like this, and you're not even going to think about him anymore. We have a bite history like that at this point. There's no further decision making. But we'll talk about these 2 cases and what ended up happening with them. So beginning, we're going through our mission here and our list of tasks as a Shelter Dog Mod Squad, and our first task is to optimize welfare. Only going to spend a little bit of time talking about this today because I could easily spend a week talking about it, and it's really not the focus of the lecture. But just reminding ourselves that optimizing welfare means meeting their needs. The first and foremost need that I see of our shelter dogs is spending time with us. Our dogs are social animals. They love spending time with us. They love being around us, and that is the most important shelter dog need. Probably the most difficult to provide in terms of time intensity, but it's very important. Obviously, other types of enrichment needs in terms of providing them with a nice place to sleep, providing them with a hiding place, a place where they can be away from the public if they don't want to be seen. I sometimes think about if I were in a place where anybody could invade my personal space whenever they wanted, I'd probably be pretty stressed and not very happy. Playing with other dogs if they enjoy playing with other dogs. Training as a form of mental enrichment and if they'll benefit from training. So making sure we're providing all those needs. Remembering that part of meeting shelter dogs' needs is maintaining their physical health, so providing things such as vaccinations, a sanitary environment, their ability to maintain their house training, so taking them out to eliminate several times a day away from their kennel, disease prevention and treatment. All those things are a crucial aspect of shelter dog needs, which we're not talking much about here today in a lecture on behavior. So that's our first step in our mission, is welfare. Our second step in our mission is identifying potential problems. So that's getting to know the dogs in every possible way through information such as behavioral history, behavior evaluation, observing their behavior while in the shelter, and that even includes information, so if we send them into the foster home, that goes into our decision-making process as well. So I'm going to be talking about how we identify or attempt to identify problem behaviors in shelter dogs. We use the Match Up 2 Shelter Dog Rehoming Program, which is a program that uses all of the available information that we have to help guide us in our treatment and placement decisions. So the components include history evaluation and shelter observations, but it also includes a personality scoring component to give us information about personality traits such as friendliness and aggression. And it also includes a behavioral triage component that gives the dogs a point score, which we'll talk about shortly. So the first aspect that we're going to talk about is behavior history. Getting a behavior history on a dog can certainly happen via behavior history form, which you see here, and there's a link to this behavior history document that we share with other shelters that can be completed online and sent to your shelter. Or obviously it can also be completed in person. In our experience interviewing and surveying shelters, we've discovered that more people do an in-person behavior history in terms of interviewing people. When you do interview people, if you do interview people, the types of questions that you ask are very important. In terms of open-ended questions are the types of questions to ask as opposed to close-ended. And so by open-ended, I mean you want to ask questions like, what does Brody do when you come home from work? How does he behave? What does he do? How does he act when you come home from work? As opposed to asking, does he jump on you? If I ask, does he jump on you, I'm going to get a yes/no answer and probably not much else. Whereas if I ask an open-ended question, I'm going to get more information. For us, behavior history also includes behavior in the foster home. So that goes into behavior history if the dog goes out to foster. And both dogs in our story have a behavior history that we'll be talking about in a little bit. The next part of our overall assessment in identifying problems is the behavior evaluation. Our behavior evaluation includes 11 subtests, things such as assessing for food aggression, how they respond to play, how they respond to training cues, how do they respond to a toddler doll or a strange-looking woman. And on our evaluation, we objectively record behaviors, meaning mark down whether behaviors occur or they don't occur. An example of the form that we use is right here. We have a paper-based version of our evaluation. This is the online version of our evaluation where you click on behaviors if they occur, and if they don't occur, you leave them blank, and then you move on to the next test. So behaviors such as wagging tail, ears back, growling, behaviors that we have determined are important behaviors in terms of helping us to make outcome decisions. And we did research to determine what behaviors were the most important behaviors for us to keep track of. So we talked about history, we talked about behavior evaluations, now we're going to talk about behavioral observations. Any other behavior that we observe while the dog is in the shelter gets recorded in this section. So whether it's staff, volunteer, public interactions, whether we're doing a further assessment of a problem, so we've already done our evaluation, we need a little more information, all this will go into the behavior observations section. So it helps us to collect as much information as possible, and it also gives everyone involved in this dog's care a voice in terms of outcome decisions. So while we talk about behavioral observations, the next thing you're going to see is a video showing, this is a video that's actually occurring after a behavior evaluation, showing how we do a further assessment of dogs who are scared of people. So this should be loading up soon. And so we do an initial assessment on fearful dogs. This is Nina. We repeat the assessment weekly if we have the time and the resources to. Starting by observing her behavior in the kennel. You can see the fear there. Her ears are back when she looks at the person who's recording her. Now you'll see someone she knows coming closer to her. You saw the tense muscles while she was looking at the recorder. She wags her tail at the person she knows. And then soon we'll see our person who's approaching her standing in front of her and saying, "Hi, Nina," in a soft, gentle voice, and seeing how Nina responds to this. This video was actually taken during a reassessment, so after Nina had been in the shelter for several weeks. And so Nina was very comfortable with Lainey, who you see doing this assessment here, and much more comfortable with her than with the person on the other end of the video camera. So getting them out of the cage, then we observe how they respond to strangers on the street. You see Nina doing a typical fearful dog behavior in terms of sniffing them from behind, where it's a little less scary. Next, we assess their interest in play because our fearful dogs are usually not interested in playing us when they first come in, our significantly fearful dogs, because they're so fearful. Nina, at this point in time, is interested in play, and when they become interested in play, we determine what type of game they like to play. Retrieving is our favorite game, but if we have a dog who doesn't like or doesn't know how to retrieve, then we'll try different games like tug or nose work or things like that. And last, we give them some quiet time and observe their behavior during quiet time. I want you to watch Lainey petting Nina here and looking at ways she's interacting with her that you would versus would not do with a fearful dog. So Lainey knows Nina quite well at this point and knows what Nina likes. But with a fearful dog who we were interacting with for the very first time, we wouldn't be touching her head or ears because they tend to be very sensitive about that. We wouldn't be touching her hair. We probably wouldn't be doing that grabbing of her skin in terms of the massaging motion because those are things that can be scary for a fearful dog. But remembering this is a reassessment, and Lainey knows what this dog likes versus doesn't like. So that's an example of after we've done a behavior evaluation, or sometimes before we've done a behavior evaluation, the initial assessment that we do to get to know our fearful dogs. So that's shelter observations. And when we combine our behavior history, our behavior evaluation, and our shelter observations, we get to what we call behavioral triage. And that's where we put everything together. All of the behaviors that we see, whether they are positive, friendly behaviors, or primarily we're looking at negative behaviors like very significantly fearful behaviors, aggressive behaviors, behaviors that make a dog more challenging to find a home, like potential separation anxiety. I just lost my train of thought there. Oh, jumpy mouthy, super excitable behaviors, that type of thing. Those are all behaviors that give dogs points in this behavior evaluation system. And so a dog with higher points is potentially a more challenging adoption. This is not a pass-fail system, so if a dog gets over a certain points, we don't fail them. This is a general set of guidelines that create a common language for us when we're making outcome decisions for dogs. But the decisions, as you'll see as this lecture goes on, are made based upon the individual dog and not only the score it receives. I'd say most dogs who participate in this behavior evaluation process receive less than 20 points. The dogs you're going to see today are going to receive more than 20 points, but most dogs are less than 20. So when we have more than 20 points, we're talking about a dog who we would almost always consider to be a special adoption in terms of needing special counseling and things like that after adoption and before. All right, and it looks like we have
a poll question. Yes, and this time I'll give everybody a little bit longer to answer your questions. And if you have any questions for the speaker, please get them up into the queue so that we can put them in the box for later on after the presentation. How heavily does your organization weigh the results of your behavior evaluation tests in making outcome decisions? That would be very heavily, you're 50-50, not much, not at all, or not applicable. So get your answers in. How heavily does your organization weigh the results of your behavior evaluation tests in making outcome decisions? And
I would expect that if your shelter doesn't perform behavior evaluations on dogs, and certainly not all shelters do. 37% of shelters in the United States do formal behavior evaluation tests. I would expect you to select not at all because you don't do the evaluations.
Okay, let's see what the results are.
All right.
Okay.
All right, so if we look here, we have a very small percentage of us who rely very heavily on the results. That's our primary way we make outcome decisions about dogs. I'm so happy to see that because that's how I feel about things, and all of us at the Center for Shelter Dogs feel as well, is that we don't like to base a life or death decision for a dog on a one-time test. And we have the vast majority of us, though, kind of 50-50, balancing how we weigh versus others, or others who are heavily but use other information. And we have kind of a broad range of responses, but virtually no one doesn't use the behavior evaluation at all, which is good. I'm glad that everyone's using behavior assessments. All right. So let's look now at our dogs. So we're going back to Nellie. Nellie, remembering, is our rat terrier surrendered by the vet student. When we look at her behavior history evaluation and shelter behavior, she has a grand total of 43 points. That's a lot of points. What challenging behaviors did she have? In her previous home, she had shown teeth, growled, and snapped at men, women, and children. She'd shown teeth and growled at the veterinarian, and she was flagged to urinate or defecate when left alone. That doesn't mean, the flagging just means that on our history form, the surrendering odor noted that she urinated and defecated when left alone. On her evaluation, she showed some jumpy behavior, usually not a problem in an 11-pound dog, but she did jump up when she was exploring the room and people were interacting with her. And not surprisingly, based on her history, she growled at the toddler doll and the strange woman. She, on her shelter behavior, so the behavior that we had observed in the shelter, she showed teeth and growled at men and women, hadn't been around children in the shelter, and she showed fear such as cower, run away, tremble around people as well. And she also showed some jumpy, mouthy behavior. In our shelter, and with our evaluation system, there also is a consideration for weight, and that in our experience, dogs that are larger tend to be slightly more challenging when they have problem behavior. So being a tiny dog takes some points off of her score. The potential problems we identified with Nellie was aggression to adults and children, fear of people, fear of being alone, so potential separation anxiety, and aggression towards veterinarians. So a lot of potential problems with Nellie, and obviously for probably a lot of us, that when problems add up, so dealing with a dog with one behavior problem, that's one thing, but when we're dealing with a dog with multiple behavior problems, that gets even more concerning. And we're going to move on to our next poll, I believe.
Yes, we are. Our next poll is coming up. What would your shelter do with Nellie, based on what you know about her? Euthanize her, send her to a foster home to gain more information, phone rescue groups and other organizations to see if they're interested in her, start her on behavior modification plan and then reassess her, find a home for her and start her on behavior modification plan, or not applicable. So we'll give you just a few minutes or a few seconds to get your answers in. Maybe not a few minutes, so let's go from there.
And lots of options there. Choose the option that is best for you.
Yep.
All right. And not surprisingly, we have a broad range of responses. And a broad range of responses, what does that tell us? It tells us that we are all different. Each one of us is different with different resources, different abilities, different willingness to accept liability risk. And so some of us would if we don't have the resources to safely rehome this dog, we'd be very sad, but might make the decision to euthanize her. Some people, 14% of you, chose to send her to a foster home to gain more information in a less stressful environment. That's a great choice if you have skilled foster homes who are trained about behavior problems, because an unskilled foster home is a recipe for disaster. A rescue group, similarly a good option if the rescue groups that you work with are qualified and have the skills and trainings to work with a dog with multiple problem behaviors. Starting her on a behavior modification plan, that was our most popular answer, and that's what we usually do with these types of dogs, is start a behavior modification plan, see if she's responding to treatment, and if she is, then we reassess her and make a decision about her. And then 3% of you said find a home for her and start her on a behavior modification plan. that is really what we oftentimes do, and that these types of dogs, obviously it takes a long time sometimes for that right person to walk through the door. And if that right person walks through the door after I've assessed her for a day or two and know that she is potentially responding, I want to get her into a home as opposed to having to wait and missing that opportunity when they came through the door. So great answers there. All right, and now we're moving on and talking about Brody. Brody similarly had a lot of points, and he had 20 points on his behavior history because he had bitten the owner 4 times. His intake history, he was returned for those bites. The owner also reported that he pulled towards other dogs and barked at them, and the owner didn't know that much about behavior and wasn't sure if he was being friendly versus aggressive. He destroyed things in the house when the owner was home. When the owner was not home, he liked to get into things. And the bite history, 2 of the bites were in the owner's yard when the dog had the leash in his mouth, and the owner tried to get the leash back, and Brody bit him. One of the bites was when the owner was trying to go somewhere. Brody didn't want to go with him, and the owner started yelling at him, and Brody bit him again. When we sent Brody home for the very first time, before this information that you see right here, I was actually the person who counseled the owner and sent him home. We talked to the owner because Brody had displayed some mild food aggression, that this is a dog you never take things from his mouth, whether it's food, whether it's a pig's ear, whether it's a toy, whether it's a sock. You never ever take things from the mouth of a dog with food aggression. And you trade for treats. That's one of the hallmarks of what we do with our food-aggressive dogs. And like some people, this owner did not listen to our instructions. This owner used dominance training techniques with this dog, showing him who's boss, alpha rolling him, dominating him, yelling at him. These are things that oftentimes with these types of behavior, dog is stressed about around these valuable items. We increase the conflict around them, and it oftentimes makes the stress worse. So that was his history, which caused a lot of conversation among us in terms of what to do with him at this point. The owner didn't have a problem with food aggression in the home. Brody did grab bones and rawhides and things like that and run away to keep it from the owner, but Brody hadn't behaved aggressively over things other than the leash. On his behavior evaluation, once he came back into the shelter, he showed some jumpy, mouthy behavior. He still displayed aggressive behavior when we evaluated him with wet food and a pig's ear. So same exact behavior we saw the first time he was around. And Brody, because he was a big dog, meaning more challenging, got points added to his total point score for his weight. So his potential problem behaviors were jumpy mouthy dog, food aggression, aggressions to adults, and aggression to children, because the owner noted that he showed teeth and growled at unfamiliar men and children but liked women, which was a little surprising to us because our experience with him in the shelter, and he had been with us for about a month the first time around, was that he was friendly to pretty much everyone. And so that's Brody. That's his grand total of points.
Now we have another poll question. What would your shelter do with Brody based on what you know about him? Euthanize him? Liability risk is too great, and our shelter doesn't have the resources to treat him. Send him to a foster home to gain more information in a less stressful environment. Phone rescue groups and other organizations to see if they are interested in him. Start him on behavior modification plan and then reassess him. Or not applicable. So submit your answers now. And we'll give you a second or two more. And let's see what everybody said.
All right. So a lot of you would have chosen to euthanize Brody. And once again, as sad as it is, I think it's a reasonable choice for him. And this is a big dog with multiple problems, multiple bites, difficult to manage, no question but that sending him to a new home is a liability risk. But There's a lot of you in other categories. So the next highest answer was people wanted to start behavior modification and then reassess. But others of you would send them to foster or try rescue, and some of you said not applicable. All right. But stop the presses here. How accurate is all this information? This is always one of the dilemmas I have in terms of us assessing and making outcome decisions about dogs, or how accurate is all this information that we're gaining about the dogs who come into our shelter? Do we know? Is it 100% accurate? Can we trust that it's true? In most cases, we can trust owner history, but they're not always going to be honest. I think this previous owner was being honest. When we talk about accuracy of assessments, we want to look at things in the assessment that we're using, such as standardization, reliability, and validity. Hopefully you all have heard these words before in relation to behavioral assessments. Standardization meaning we want the test to be done and scored and interpreted the same way by multiple different evaluators every time. So we do it in a standardized, the same way every single time. Whereas when we talk about reliability, we're talking about the consistency of the evaluation. So if you and I watch a video of Brody, would we give Brody the same assessment? Would we give Brody the same score? When we talk about validity, we're looking at whether the assessment shows what we want it to show. So there's lots of different types of validity. One of the most important ones to me is predictive validity. Does behavior on the assessment predict future behavior in the home? Right now we don't have an assessment that's currently being used in shelters that has been proven in peer-reviewed journals to be highly valid or reliable. One of the challenges in terms of accuracy of assessments is the influence of stress and the environment on personality. We all know shelters are stressful places to be, and as much as we try to make them a better place for our shelter dogs, it's still stressful, and that is going to influence our dog's behavior. Influence the behavior. The accuracy of our assessments are influenced by the frequency of the behavior. So how often is this behavior occurring? If it's a behavior that's occurring all the time, we're likely going to catch it and be able to track it. If it's a behavior that's happening infrequently, it only happens once, we don't know if this behavior is something that the dog's only doing because he's so stressed right now, we only saw it once, or this will never ever happen again in the dog's life. I sometimes think about the fact, I hate to anthropomorphize, but if someone had a score sheet that marked, I tend to be a pretty calm and quiet person, and I don't yell very often. But if someone had a score sheet that marked every single time I yelled at something or someone, or even tracked it when I was in my car alone, which is probably the primary time that I yell, and the life or death decision was being made about those results, I probably wouldn't do so well. And so that's a concern I have related to the accuracy of our assessments and our assessments in terms of how fair is it that we focus primarily on negative behaviors. And a single negative behavior is sometimes a death sentence. Obviously, we're faced with making really, really tough choices that we don't want to have to make, but it happens. And obviously, the skill and knowledge of the evaluator can influence the accuracy of our assessments too. So when it comes to making outcome decisions, we are making outcome decisions based upon individual dogs. We want to evaluate the dogs and look at problem behaviors. Oh, and this slide went back. I don't know if everybody else's slide just went back, but mine just went back without planning on it. All right. We, in terms of evaluating individual dogs and their individual personalities, we're not perfect. So should we expect our dogs to be, and should we expect our dogs to be on their perfect and best behavior when they're in the very stressful environment of the shelter and away from a home? So we make our decisions based upon individual dogs. and we make our decisions based upon our shelter's capacity for care. We have to evaluate our shelters. What is the overall welfare of the shelter dog and cat? We're not talking about cats today, but cat and other population. In that if we decide to keep Nellie or Brody and they take up a ton of our time and we're not able to provide other animals in our care with basic, what I feel are necessities, then I don't think we're making a good decision in terms of saving and trying to help. Providing everyone with welfare and their physical and mental health needs is certainly a priority. We also make our decisions based upon our individual shelter's ability to safely rehome the dog. So we have to evaluate our community and keep our adopters safe. We have safe in terms of protecting them from physical harm, but safe in terms of thinking about the emotional toll that a problem like aggression can take on an owner, and the fact that they are now stuck with this, or unless they decide to euthanize it, they're now stuck with this dog that they adopted and don't know what to do with and are stressed about living with it on a day-to-day basis. So we think about those things, safety and emotional toll, and we also think about, is there a potential adopter in your community who would want a dog with these behaviors? Nellie is a lot easier for many of us because she's a tiny dog. It tends to be a lot easier for us to find homes for tiny dogs than big dogs like Brody. So that's talking about the challenges in terms of accuracy of assessments. We don't have assessment tests that are 100% accurate, and talking about how we make outcome decisions. So what did happen with Nellie? So Nellie was fostered by an intern of ours to try to evaluate her separation anxiety or potential separation anxiety, and also to see how she did in a different environment. Nellie was very, very stressed in our shelter. And Nellie whined when she was left alone, and when her male roommate sat near Nellie on the couch when she had a rawhide, Nellie snapped at him. So she did display some aggression over food, at which point our intern brought Nellie back to the shelter. I contacted her former vet student owner to gain some more information. We didn't get super thorough information when Nellie was surrendered because her owner was having some personal problems, and asked her about could Nellie be left alone in her previous home. And the previous owner said she never left her all the way alone. She always left her with another dog. And when she tried to put her in a crate, like we had tried to do, she was very, very anxious and couldn't be left in a crate. She was very scared of loud noises, something that we had experienced too. And she had displayed some aggression over food. So interestingly, when we got more information from the previous owner, it confirmed some of our experiences with Nellie. So we decided to place Nellie for adoption through our special adoption program, and you'll learn about that later, for the following problems: separation anxiety, fear of people, food aggression, and also to provide her with enrichment, to treat her problems, and to monitor her and regularly reassess her anxiety. Well, what about Brody? There was lots of debate about Brody within our shelter. If we didn't have the previous owner who had used dominance theory and techniques with this dog, Brody probably would have been euthanized. But we did have this owner who had treated this dog in exactly the way that we recommend not doing. And those concerns and Brody's sweet, friendly, wonderful demeanor around us while in the shelter made lots of people want to give him a chance. But we weren't comfortable giving him a chance without seeing how he behaved in a home environment away from the stress of the shelter, because this may be one of the dogs that is more confident away from the stress of the shelter, and that's when we start to see the aggression. But who are we going to send him home with? This is a dog who has bitten 4 times. I'm not sending this dog home with anyone except someone who is super, super, super experienced. So Brody came home with me for a couple days, and he did great. No problems at all. My husband wanted to adopt him. I had to say no because we already had 4 dogs. And we had a baby coming in about a month, which complicated factors. But so next, one of our experienced volunteers, all our volunteers loved Brody. Amy Sutherland took Brody into her home, and he had no problems with her either. So in an experienced home who utilized what we consider to be humane and proper training techniques, traded for treats, didn't grab things out of his mouth, Brody was a very good dog. Excitable dog, but a very good dog. So based on that information, we decided to adopt Brody out as a special adoption for those problems you see listed on the screen. There was still a lot of debate in the shelter, still a lot of people who said, you're crazy for sending this dog to a new home. The liability risk is too high, and I could not argue with them. The liability risk was very high in the shelter, but like I said, because of those techniques that were used, we felt he deserved the chance. We didn't want to bring him back into the shelter. We really didn't want to. We wanted him to stay in foster until adoption, if at all possible, to avoid the stress of being back in the shelter. All right, so now we're going to move on and go to our next part of our mission for the Behavior Mod Squad. So we spent a long time talking about identifying problems and making outcome decisions. Now we're going to talk some about behavior modification and what we do for these dogs. So starting behavior modification, my first question is always, is a plan needed? Because in our shelter, matching a dog to the right home is the most important part of our plan. When we do behavior modification plans, we primarily do them in terms of assessing a response to treatment. I want to know that they have the ability to respond to treatment, which most dogs do, but some dogs are just so stressed but that they don't respond. So in our shelter, in most cases, matching them to the right home, and there you see a very special adoption of ours, Dennis and Vinny. Vinny was a fearful dog. That's what we do. But we're going to talk about the behavior modification plans that we do. So I'm telling you that we focus on the matching part of things, finding that home where that problem is not a problem. But what do we do in terms of our behavior modification plans? Our goals of our behavior modification plans are to assess risk, determine whether they respond at all, like I mentioned, determine the type of adopter that is going to be best for the pet. So we may be giving this dog a detailed behavior modification plan, or it might just be one-time further assessment like you saw in the video earlier on in this lecture. We always remember that our pets are usually not cured via these plans. We're treating and managing them, and it's all about finding the home in terms of maximizing our chances of success. We have to evaluate our resources every step along the way. Do you have someone in your shelter who is qualified and has the time to provide care for these dogs? These 2 dogs, Brody and Nellie, require a lot of time, effort, and care. Related to care in the shelter, related to adoption counseling, related to post-adoption follow-up, related to behavior appointments after adoption if they need them, and how are you going to provide it? We want to begin with plans and protocols, so developing protocols and policies so that we are all treating and managing dogs the same way. So everyone in our shelter knows that you don't alpha roll dogs. Plans and protocols in terms of training and everything. Staff training, volunteer training, we train everyone. So when we talk about staff training, lots of different ways we train them through lectures and hands-on training. Some of the important components of trainings that we do, learning about canine body language, safely using behavioral tools like a head collar, teaching staff how to objectively assess and record behavior, learning about basic principles of behavior modification. All those types of things are important parts of our trainings. So in terms of behavior modification, I'm going to talk about a bit about our behavior modification plan for jumpy mouthy dogs, for a dog like Brody. And right now you see a screenshot from the Center for Shelter Dogs website, which has a behavior management tool for jumpy mouthy dogs that has handouts. Some of the handouts you have links to today in terms of helping shelters to manage these jumpy mouthy dogs. It can be very, very challenging. This is an example of a training plan for jumpy mouthy dogs, but remembering it's an example. Every dog is an individual, and we don't have a cookie cutter approach because a cookie cutter approach doesn't work for all dogs. So you see a generic training plan listed there as a suggestion, but we do certainly individualize our plans for dogs. And next we're going to be watching 2 videos. The first video is going to be about safely walking a jumpy mouthy dog through a kennel. And the second is going to be a video of treating jumpy mouthy behavior. And this is one of our interns with jumpy mouthy baby doll. Adopted probably not very long ago. Just got a puppy. It was only 2 weeks ago. So she, like many jumpy mouthy dogs, grabs and puts on her leash. Working with our jumpy mouthy dogs is all about prevention. We teach them what we want them to do, have them focus on us and focus on good things instead of getting bored and resorting to things like grabbing and tugging on the leash. So now our next video is of a jumpy mouthy plan in action. This is a training session with a jumpy mouthy dog, and you'll see Buster, Boston Terrier. Small dogs are typically not on our jumpy mouthy plan, but Buster was a different story. He was jumping, not a big problem, in an 18-pound dog, but very, very mouthy, and I believe he had broken skin with his mouthiness. Super excitable dog who had trouble learning how to calm down. We don't usually play tug with our jumpy mouthy dogs first off. That's something that we play as they progress with the plan. So we start with retrieving. Once they're retrieving and sharing with us well and have learned drop it, then we go up to more exciting games. We want them to learn. You get really excited, you calm down, you listen to us, and then the play starts again. So you can see Lainey and Buster having a whole lot of fun. And that's what our training sessions are. We try to make them be a whole lot of fun. We have a minute or 2 or 3 of playing with the dog, and then we have a minute or 2 of training cues, and then a minute or 2 or 3 of training, so we go back and forth so the dog stays interested, focused. You saw him look at her shoe a little bit there. Buster really liked to target shoes. So train, play to keep him focused and interested. And you see Buster really enjoys training, and a lot of our jumpy mouthy dogs really enjoy training. And we also work on crate training with our jumpy mouthy dogs because some of these dogs, and most of these really jumpy mouthy dogs, have a really hard time calming down. So we crate train them and teach them to stay comfortably in a crate so that the owner or the new adopter can get a break from the dog when they need a break from the dog. All right, I'm going to cut this video off here and move to the next slide. This is an example of a document that we share with our volunteers in terms of how to interact with these dogs. Some of the very important things we teach about working with our jumpy mouthy dogs is we train these dogs what we want them to do. These are dogs that they're so excited they always have to be doing something. So we teach them that when you sit, that's what gets you attention, which is our Say Please program. We teach them to drop things. We teach them to trade things for treats. We don't use punishment techniques. We don't yell at them. We don't do alpha rolls. We don't do things like that when we are working with these dogs, because what can happen is like what you saw happen with Brody. All right. And my internet connection slowed down for just a minute there. I apologize. So that was talking about the behavior modification plan for jumpy mouthy dogs. Our focus is on enrichment, meeting these dogs' behavioral health needs while teaching them skills to control their impulses and inhibit their behavior. What about behavior modification for fearful dogs? You see cute Nellie there. So when we talk about fear, I'm just going to talk very briefly about an example of how we do our trainings for fear. Our staff and volunteers want to learn. They love to learn. And so we have trainings where we teach about principles of behavior modification. We teach them about everything we can because they love it. And so I'm going to talk briefly about different definitions related to fear and anxiety. Fear being an adaptive, physiologic, and behavioral response to a real threatening stimulus. So man comes at me with a knife, screaming and yelling like he's going to kill me. That's a real threatening stimulus, and that's when I experience fear. However, when I advanced too quickly. When we talk about anxiety, we're talking about a profound physiologic and behavioral response and an apprehensive anticipation of this stress-provoking or fearful event. So if every time now that my mother takes out a butter knife from after I had that one experience with the really scary guy, every time my mother takes out a butter knife, I run away screaming. Now this is an anxiety. This event is not at real risk of occurring with my mother, but I've developed anxiety because of that previous experience. Whereas when we're talking about a phobia, we're talking about a severe physiologic and behavioral response, and it's a maladaptive response. It interferes with the ability to participate in normal life. And Nellie definitely experienced anxiety in relation to separation, in relation to life in general. She was an anxious little dog, and still is an anxious little dog sometimes. So that's fear, and distinguishing it from fear aggression. And because fear people may develop into aggression towards people over time, like it did with Nellie. So behavior modification for fear is very important because we want to do everything we can to minimize the fear so that fear doesn't turn into fear aggression. So our plan for dogs like Nellie, and see Nellie with her original foster mom, Kelsey, is initial training with highly experienced and trained staff and volunteers only. So we keep our staff and volunteers safe by only having experienced people handle her. And our training plan includes avoiding things that cause fear and anxiety. It includes putting her in playgroup. We found that our fearful dogs, getting them around other dogs if they enjoy it, which many of them do, allows them to be a dog, release a lot of stress, and in our experience, it really helps them to make progress. We use treat buckets to have visitors and staff toss treats as they walk by their cages. Say Please program and basic training once they're interested in training and those types of things. Creating positive associations as often as we can with strangers and people that she's normally scared of. And quiet time is a very important aspect of these training plans in terms of giving these dogs downtime where they can simply relax with us. So we're going to see a couple videos here in terms of our training plans. I'm just waiting a second here as it loads up. This first video is going to be an example of our fear of people training plan. And it's not loading on my screen. I don't know if it's loading on other people's screens.
I have it, Dr. Darpino.
It's playing?
Yes.
All right. I'll try that.
And now she's in her office, Foster.
Great, and you'll see her there, people tossing treats as they walk by, spending time in offices so they can be away from the other barking dogs in the kennel. Obviously, we're trying to train them not to. bark in their kennels, but away from her kennel where people can create positive associations by tossing treats and not staying and staring at her, which was scary to her.
I've advanced your next video.
All right, awesome. And this next video is demonstrating using treat buckets for fearful dogs. We're going to be seeing 4 videos here.
And this is the second treat bucket.
So we gradually increase the intensity of our exposure. So initially we walk by without stopping. Then as the dog gets comfortable with that, we stop briefly. And then gradually we added talking to the dog.
So we're seeing treat bucket number 3.
All right. So this is, I believe, where we start gently talking to the dog as we say hi in a very soft voice. And in the 4th video, you'll see Lainey stopping and talking to the dog. So the dog is now completely comfortable with her interacting. So we work in baby steps. All right. So our training plan for these dogs is we teach staff what to do in terms of create positive association and avoid inducing fear, and what not to do. Not use things like aversive, dominance theory. Don't force interactions when a dog doesn't want to interact with us. We let them approach us on their own terms. Now we're going to talk briefly about medications for problem behaviors. In our shelters, some of these dogs benefit from medication and behavioral medication. Our primary indications in our shelter for using medication are poor welfare and severe anxiety. Those are my primary situations where I consider using medication. So, talking in a little bit more detail about medication. So what about Brody? Would you use medication for a dog like Brody? Well, Brody experienced anxiety in his previous home when he was with us in the shelter, and in his foster home, he was not an anxious dog as long as he was treated with humane training techniques. So we didn't feel that Brody needed medication. But what about medication for Nellie? Nellie, once she came back from Kelsey's foster home and had to be back in the shelter, her anxiety got worse and worse. And we now knew she had separation anxiety. And with our separation anxiety dogs that we adopt out, we usually put them on medication to do everything we can to smooth transition into a new home. What we also did with Nellie is we got her into a new foster home because she was getting so horribly stressed in the shelter. But we're talking about medication now. Before we consider using medication, we explore other options for enrichment. We explore other options for changing her environment, like with Nellie putting her in a foster home. And we think about the fact is, would this dog need medication if not in the shelter? And if the answer to that is no, I try to do everything possible to make that dog's life better, whether it's sending it to a foster home or whether it is upping the enrichment routine so that that dog is less anxious. If we're doing everything we can and there are no other options, it's a welfare concern for me if the anxiety is severe, and we will use medication. For the veterinarians in the audience, my drug of choice for separation anxiety is Fluoxetine, which is a Selective Serotonin Reuptake inhibitor, or SSRI. You see the dose on the screen that we use there. It is labeled for use in separation anxiety. It takes days to weeks to begin working, so when we do decide to place a dog with separation anxiety into the home, we put them on the medication as soon as we've identified the problem and are confident that the dog has the problem. The other medication that I use fairly commonly, and having said that, I probably use medication about 7 or 8 times a year on our shelter dogs, so not frequently, but it's Trazodone. Trazodone is a serotonin antagonist and reuptake inhibitor. It can be used as an adjunct to a primary medication, such as an SSRI like fluoxetine, or it can be used as a short-term anti-anxiety medication. And I've had very good success with it in terms of relieving shelter dog anxiety. And you see a dose on the screen. If we have veterinarians in the audience who are interested in using this medication in shelter dogs, I encourage you to contact me and talk to me about it, and we can talk about details. But Trazodone, I'm very, very happy with using it for short-term anxiety relief. All right, so as I said, Brody, did we use medication? No, we didn't use medication. Nellie, we used fluoxetine at 1 milligram per kilogram once a day. So now we're on to reassessing our next stage in our plan. Treatment duration, other considerations when we're working with these dogs. In terms of most of our fearful dogs and most of our jumpy mouthy dogs, they tend to respond very quickly when we are using a good training plan, have good well-trained staff and volunteers, and are providing them with adequate enrichment. But continued treatment while they're in the shelter is crucial. Our jumpy mouthy dogs are often more likely to be returned than dogs with many other serious behavior problems. So while jumpy mouthiness is excitability, a lot of us don't take it very seriously. We take this problem very seriously because it's oftentimes a deal breaker in terms of success of adoptions. So we assess progress through day-to-day interactions. Repeating behavior evaluation, we do that once a month. We don't reassess food aggression through our behavior evaluations because we find that many of our dogs are sensitized to that fake hand, so we assess it through day-to-day interactions with the dog. And sometimes we try to assess progress by sending them to a real-life environment, like we did with both Nellie and Brody. So now we're going to talk about rehoming. The happy part, right? So finding the right home for these dogs is we're trying to place pets for adoption that will be safe and not bite or harm people in our community, and matching them. We need to be honest to our adopters and tell them everything about the dog, and we need to be flexible. We also need to have the capacity to treat them, as I talked about earlier. On average, our special adoptions, so dogs with separation anxiety, jumpy mouthy, food aggression, fear, stay in the shelter on average 10 days longer than dogs without these special adoption concerns. So we know they're going to stay in the shelter longer, and that's something we have to be aware of as we're planning for these dogs. So adopting jumpy mouthy dogs, we want to find active people who enjoy training dogs, because these dogs are going to require a lot of training. Hopefully people who enjoy exercising, and people who are willing to invest the time, energy, and effort and seem to understand what we're recommending. Like Brody's first adopter did, and then unfortunately we found out that he didn't follow our instructions. And that certainly happens in some situations, that adopters don't follow our recommendations and a dog gets returned. When that does happen, we don't necessarily consider it a failure of the dog. We don't necessarily consider it a failure of the adopter. We consider it a failure of the match. In some cases, it certainly is a failure of the dog or a failure of the adopter, but in the vast majority of cases, it's a failure of the match, and we need to find a match for this dog where it's a person who their personality will do the right things for the dog. All right. When we're talking about adopting out dogs with fear of people, so talking about these two dogs, two major problems. With Nellie, she needs a quiet home, and people who are very understanding of fearful dog needs, and very patient people. Those are actually Nellie's adopters there. People that understand fearful dog needs and are willing to provide them with it and really don't have a problem with it. And we need to think about the risks and benefits every step along the way with these dogs, because the only way to guarantee that we won't have a pet with a problem in the home is not to own a pet, not to adopt out a pet. Aggression and problem behaviors are a risk with every single adoption and something we need to be aware of. These two dogs happen to be very complicated cases. They happen to have very happy outcomes, but it's important for me to mention that Not every dog we deal with has happy outcomes, but I thought you guys would have been kind of depressed if the stories I told were of dogs with sad endings. But we do our best, and we have a lot more happy outcomes than the sad ones. The sad ones are few and far between. So in our appointments with these dogs we consider special adoptions, we provide full disclosure. The owner takes home a piece of paper, which you'll see on the next slide, that tells them everything about what we've observed, what we know about the dog, and they read it while they're sitting there with us, and they sign it. So full disclosure, Brody's paperwork said he had bitten 4 times. Scary for a lot of people to do, but we are very, very honest. We demonstrate the problem if we can, which at the time of Brody's adoption, he wasn't having problems, so we couldn't demonstrate it. And we discuss and teach a plan for management. So we don't talk about treating the problem in that special adoption appointment because we don't want to overwhelm people. We talk about how to manage it in the home, how to avoid problems, how to initially interact and bond with their dog, and they give them handouts about how to do those things. And that's our focus, is to help them bond with their dog and to have safety in that first week. If they want to treat their dog, we do give them the option of coming back for treatment appointments later on. This is an example of the full disclosure form that we send home with our adopters. It's a little snippet of it, but tells them about everything we know about the dog. And they also sign something saying, I'm aware of these dog's problems and I'm still adopting him. Follow-up. So if I was not able to do special adoption counseling, and if I were not able to do follow-up with these special adoption dogs, especially dogs like Brody and Nellie, I wouldn't be adopting them into home. It's just such a crucial part of the picture. So in terms of follow-up, that dog is Bolt, another one of our special adoptions with fear. We phone the adopter at 1 week or sooner. Sometimes I really want to make sure things are going okay, so I oftentimes call them the next day. But 1 week, 1 month, 2 months, 3 months if necessary. And if we do need to continue support, we certainly do longer. We have a questionnaire that we use as a guideline for the conversation. And we ask specific questions about the pet in terms of how it's doing, its problems that resulted in the dog being a special adoption, to gain a picture of how the dog and the problem that we sent home with is doing. Are they having problems, which usually they're not, but sometimes they are, or are they having any other problem behaviors that we didn't identify when the dog was in the shelter? In terms of follow-up, we also offer 50% discounts on training classes through our shelters and our dog trainers. We offer free behavior appointments with myself or our trainers for 6 months after adoption with the dogs and cat, any dog or cat who is adopted from our shelter, special adoption or not. We provide them with phone calls and emails and all the support they need, and the adopter really knows that we're on our team. These adopters become our friends and stay in close contact with us. This is Nellie. They send me cute videos of her and her buddy there, Bosworth, all the time. If you go to the Center for Shelter Dogs website and our Shelter Dogs blog, you'll see a blog about Nellie and how she's doing in her home and how much they love her to death. She has no problems. She has a very happy life. She's not aggressive over food. Yep, she's still somewhat nervous around noises, and they introduce her to visitors slowly, as I taught them to do, but they think she's the best dog in the world because she has an amazing personality, and they love her. That's what happened to Nellie. What about Brody? So Brody, we were very, very lucky in that shortly after he went to his second foster home, that perfect person walked through the door. And this is a picture of Brody and his adopter. I believe this is about 2 months after adoption, but Brody did absolutely amazing. So I'd like to say we lucked out with this one, but there was a lot of hard work that went into it as well. A lot of hard work into doing everything possible so that we could feel that we gave this dog the best chance. We could have just easily have failed, and this could have been a horrible ending to the story, but luckily Brody has a very happy ending. So that's talking about our Behavior Mod Squad, working through all the steps of our mission. Wish I could have had an hour to talk about every step, but I'm so happy to talk to you all tonight about modifying behavior in the shelter environment. The next thing I want to talk to you guys about for the veterinarians in the audience is that the University of Florida and the Maddie Shelter Medicine program at Florida is offering a shelter animal behavior and welfare course starting in January. I'm very, very excited and honored to be teaching this course, the first of its kind in the country, where we are going to be going into a lot more detail in all of these problems. So if you are a veterinarian or you know a veterinarian who's interested in shelter animal behavior and welfare, definitely encourage you to learn more about this course and go to the University of Florida website to learn more about it. Lastly, I wanted to talk to you about other webinars related to shelter animal behavior. The Center for Shelter Dogs, we have a webinar series and monthly webinars about different shelter animal behavior topics. ASPCA Pro, who I don't happen to have a slide for, but they also have a great webinar series about shelter animal behavior. So there's more and more research resources out there nowadays in terms of learning about shelter dog and shelter cat behavior. And that is the end of my presentation today. I thank you all so much for attending, and I look forward to answering questions.
Okay, we have a few questions for you. Let me get the first one up. What could you do for a fearful dog who is scared in the kennel but not outside of the kennel?
Oh, I think I prompted whoever asked that question because that's a great question that I didn't include in my lecture. So very common for us that these fearful dogs get a lot better when out of their kennel, but when they're in this enclosed space in the kennel and people they don't know walking by them, they bark aggressively at visitors. And we want visitors to adopt them, but if they're barking aggressively at the visitors, they don't get adopted. So what we do with these dogs, that's why we have treat buckets, because we ask people to toss treats, but that doesn't always work with our fearful dogs. So with our fearful dogs, and especially dogs like Nellie, they don't go on the adoption floor. We put them up for adoption on the internet, because a dog like Nellie, people see her picture and everybody wants to take her home. A lot of people, once they learn about her problems, they change their mind. But we put them up for adoption over the internet and keep them in areas of the shelter where visitors don't view them. Or with some of them, we'll have experienced volunteers spend time with them in our lobby so that the dog isn't behind a barrier, and then the volunteers train to very, very carefully control interactions with visitors so as not to provoke the dog's fear. And I hope that answers your question.
Okay, here's the next question. Are either of these two dogs, Nellie or Brody, still on medication?
Oh gosh, you guys are answering great questions. So Brody was never on medication, so no. And Nellie, not either. So that's always a dilemma we have in terms of deciding whether to use medication, is if a potential adopter learns the dog is on medication, that might deter them from adopting. So that is something we consider when we put dogs on medication, but our biggest concern is the dog's welfare. So if the dog needs medication, we give them medication. Nellie, I ended up fostering her. I believe I said that in the lecture, after the initial foster person until she was adopted. And as soon as I moved her into my home, I weaned her off of medication. She was in my home for, I think, a week and a half before she got adopted. My home seems to have this marvelous as soon as I take a dog home for a foster, someone becomes interested in adopting it. But so I was able to wean her off of medication. But some of our dogs we certainly do send home on medications with instructions for weaning them off. Usually we start weaning the medications 2 to 3 weeks after they've been in the home, except for cases of separation anxiety, where we usually keep them on it for longer. Didn't feel that Nellie needed to stay on it for longer because our plan was to adopt Nellie to a home with another dog, and we knew that as long as Nellie was with another dog, she did not display anxiety.
Okay, here comes the next question. Do you have a hard time finding enough people to adopt these special adoption dogs? And if so, how long does it typically take for the dogs to get adopted?
All right. So sometimes yes, sometimes no, and that's something I mentioned in the lecture, that is something we take into consideration when we're deciding whether we can rehome this dog, and that if it's a dog that because of it has a medical problem and 3 behavior problems, it's going to take 6 months for that 1% of the human population who could adequately care for this dog, or they may never come in the door. Sometimes we make the hard decision at this point in time in our shelter, we can't rehome this dog. They probably still wouldn't fall into the unhealthy and untreatable category for us, but we recognize that we just don't have the resources and the community where we can place the dog at this time. And how long does it typically take? It really, really varies. We have special adoption dogs. So I always say most of our food-aggressive dogs we don't do a behavior modification plan on, not because we don't want to. We really need more video demonstrating how we treat these dogs. But many of our food-aggressive dogs get adopted pretty quickly and before we have the chance to do behavior modification. In our community, which is Boston, a busy city where there's a pretty high demand for dogs. But some of our dogs stay with us for months, some of us for as long as 6 months. When we get a dog who has been with us for 3 months, we really, something is wrong in terms of what are we doing wrong in terms of this dog not finding a home? What do we need to change? Or do we really need to think hard and make those tough decisions that we're not going to find that right person to walk through the door? Luckily, in most cases we do, but sometimes it happens. So it really varies, but on average, our special adoptions length of stay is 39 days, and our regular adoptions, excluding puppies, and for us puppies are under 6 months, is 29 days. So we have a pretty long length of stay for even our regular adoptions. And that's probably because we do adopt out pit bulls who tend to stay longer.
Okay, the next question is, why was the severity of the bites not more explicitly discussed in the context of outcome decision?
I think that's a very good point to mention, and I'm very glad you asked that question because I think it is a very good thing to talk about and discuss. In that Nellie had, and so thank you for asking, Nellie had displayed aggression many times in her history, but she had never broken the skin of anyone. But Brody had bitten and broken the skin 4 times. So Brody bit and had broken the skin. He didn't cause any severe damage. Lots of things that come into factors in terms of making outcome decisions. Severity of the bites are a big one. The predictability of the behavior, is it very predictable and so I can control and manage this dog in a way that's going to prevent it from happening versus not so predictable. I look at the lifestyle of the people in my community and their the potential adopters to see whether there's someone who can potentially manage and would be interested in managing this problem. So a lot of different factors that I didn't discuss today in terms of making outcomes decisions, and the severity of the bites is certainly one of them. However, I will say I really want the research, but it's going to be hard to get. There's no research out there that tells us information that a dog like Nellie, she hadn't ever bitten up to the time we saw her, that guarantees that she's not going to bite. So we don't have that research looking at specifics of behavior in terms of aggression and whether that behavior stays consistent over long term. And my experience is that a lot of times it does, but we never know when that dog is going to be exposed to circumstances unlike they had ever been exposed to before. Such as with Brody, his first home, he was treated very differently than he was in his second home. So he was in a very unique set of circumstances. So many things that come into play, and thank you for bringing up that topic.
When your dogs are undergoing behavior modification, are they off the adoption floor? How do you work around losing consistency from visitors and other staff not asking the same behavior questions as the trainers are?
So that is a very good question, and one we oftentimes get from trainers and shelters that we work with. So it depends on the problem. At our shelter, once we have decided that we are going to place this pet, so once we've made that decision, they are eligible to go on the adoption floor, if there is space on the adoption floor. Because as I said earlier, it may take a long time for us to find a home for the dog. So the sooner he goes on the website or the adoption floor, the more likely that is to happen. And then we do lose consistency in terms of training. And no question that many and most of our shelter dogs are very good for staff and our experienced volunteers, but not the same for visitors who walk by. And that's what why I recommend using treat buckets, posting signs around your shelter for visitors even, asking visitors, and I believe in your documents you have a treat buckets poster example, asking to toss dog treats to create positive associations with people, and we can also create signs asking visitors to reward good behavior like sitting or giving them the treats when they're not barking or jumping. So we can attempt to involve them in the training plan. A lot of times the visitors aren't going to follow that anyways, but in my eyes, that classical conditioning, that associating visitors with treats, yes, they're not following my training plan, but good things are still happening.
And the next question is, please discuss liability issues for adopting pets with histories or shelter observations of aggressive behavior with humans.
Great. So liability issues are a huge concern, and shelters have definitely been sued adopting out pets with known histories of aggression or aggression that's been observed in the shelter, and then the pet then displaying aggression in the new home. So liability certainly exists, and I am not going to deny that in any way, shape, or form. I encourage you all to visit the website dogbitelaw.com. It's a website of a lawyer, and he has a specific section of his website about shelters and limiting your liability as a sheltering organization, and of course of a DVD for you to spend lots of money and buy and learn more about his programs. But there's some good information on his website that you can get for free in terms of attempting to limit your liability. And obviously that's a concern. Liabilities are a concern, and protecting the public from physical harm and the emotional harm of adopting out pets with problems. Nowadays, we have to consider liability on both sides of the coin. Recently, I saw two different stories about shelters. One about a shelter that was being sued because a dog bit after adoption. One about a shelter that was being sued because a shelter euthanized a dog that bit after adoption and didn't give a rescue group a chance to take him. So liability exists no matter what we do, so we just have to behave in a way that protects us from liability issues as much as possible and gain as much information about the dogs in our care as possible. So we're making good decisions for the dogs that give them lives with good welfare and good decisions for the people in our community. We can't save them all, unfortunately. I wish we could.
Well, I'm trying to get your next question to you.
All right.
Doesn't seem to be working. Actually, my screen has frozen up, Dr. Darpino.
All right.
So
well, I can read a question right now. I have someone who wants to sign up for the University of Florida course. We have an idea of weekly time commitment? An online course is a time commitment. You can expect to spend about 5 to 8 hours per week on the course. The course starts in January, and it lasts for 16 weeks, the entire spring semester. So it's a big course, and we're really excited to be offering it. I encourage you to email me or visit the University of Florida Maddie Shelter Medicine Program to learn more about it. All right, next question is about supplements.
Okay, no, I don't have the next question, but I think we'll probably wrap up for the evening.
Okay.
I need to have I've lost the screen completely. I'm sorry to the audience for this technical problem, but if you'll put up the survey URL, then we'll just close out. So I want to say that Dr. Darpino, we really appreciate your being with us tonight, and all of you out there for your time tonight. We hope you'll join us on February 7th for our next webcast, Cracking the Infection Control Code, Using and Interpreting Diagnostic Tests to Control Infectious Diseases in Shelters, with Dr. Ronald Schultz. So we hope we'll see you there. Please click on the link to take our survey. It might have been blocked by your pop-up blocker, or it may be on a different screen. Don't worry if you can't see it. We'll be sending a link to you, and we would really appreciate it if you would take a few minutes to respond. We hope you checked out the resources on the widgets at the bottom of your screen. But if you didn't get a chance, you can find them on our website at www.maddiesinstitute.org. The archived version of tonight's webcast will be available within a week and can also be found on our site. While you're visiting the website, sign up for our newsletter and our blog, and please show your support for us by liking us on Facebook. Thanks again for being here with us this evening. Have a safe and happy holiday season. We look forward to seeing you in the new year. Good night, everyone.
Good night. Thank you so much, Lynn.